For the Stoneham Coalition, my name is Dennis O'Hara, and I'm joined today by Becca Lewis, the Substance Use Prevention Coordinator for the town of Stoneham in the Public Health Department. Welcome.
Hi, Dennis.
So May is Mental Health Awareness Month, and we've been posting some things on social media and talking about mental health. And so, why don't you talk a little bit about Mental Health Awareness Month and the different types of resources that are out there for those seeking information?
Sure. Yeah, as you mentioned, because May is Mental Health Awareness Month, we really want to use this as an opportunity to let the people of Stoneham know the resources that are available to them. One great resource that we're trying to get out there more is the Massachusetts Behavioral Health Helpline. That's a great resource. You can either go to masshelpline.com and have an online chat with somebody. You can call 833-773-2445 to talk to somebody on the phone, or you can also text that number. So it's really great that you can um, use whatever format you're most comfortable with. And then, as always, the suicide hotline is 988. That is also something we're trying to get out there. The more people who know about it, the better, just in case anybody needs it. And then also, I wanted to mention that one of the great parts of the community of Stoneham and the coalition is how connected all of the different sectors are. So if you or somebody you know is struggling and you don't know what a good first step is and you don't know where to start, you can always go to the police station, the fire station, come down to the health department and town hall, the library, the schools, or the senior center. And all of those entities are so well connected and communicate all the time. So even if they can't help you with your specific issue, they can connect you to somebody who can. So that is always important to know that any of those town resources are available for anybody. And like I said, even if they can't help you, they can point you in the right direction. So if you don't know where to start, any of those are great resources.
Mhm. And what happens when you call one of these support lines? Do you have to give out your information, your insurance, or anything like that?
Yeah, so the great part about the behavioral health helpline is that it can connect you to mental health services regardless of your insurance coverage. So whether you're insured or not, or regardless of what plan you have, they can connect you to whether you're looking for substance use treatment, just individual therapy, anything.
Mhm. And it's important to know also that these resources are available throughout the year. It's just in May is the month that we've chosen to sort of push it out there and let the information sort of sink in. But they're available throughout the year, and they're free. So it's a wonderful service that's provided. Now your focus is on substance use prevention, and the coalition is sort of backing you up on that with helping people find resources. Now. So why do we care so much about Mental Health Awareness Month? Let's try to make the link between mental health and substance use.
Yeah, a lot of people think of mental health and mental illnesses as separate from substance use disorder, but they are very connected. It's really hard to treat substance use without treating mental health. And a lot of times, mental health or mental illnesses can be a precursor to substance use. So, especially my focus in youth prevention is that early identification and destigmatizing those conversations about mental health so that people can get help early and we can get ahead of it, to reduce the likelihood that a child will end up using substances. So this is kind of all part of what we're trying to do for Mental Health Awareness Month is just have more conversations about it. Mental health has never been more talked about, but it's still stigmatized. So we still have work to do about making care more accessible, about giving people the tools and like self efficacy to be able to stand up for themselves and advocate for their needs and get their needs met, in all aspects of health, and mental health being one of them.
Now you just brought up a good point. I mean, a lot of people think of mental illness as sort of an later in life adult problem, but it's not. It can begin in youth, correct?
Right. And we're really lucky in Stoneham to have a great school counseling services. So for parents or caregivers or students, I would say the schools are a great place to start. And they can, connect to outside resources if necessary. But yeah, the schools are very equipped to kind of be that step one for parents and youth.
Right. So we've been sharing a lot of content on our social media from Mental Health America. They've been, they have the great support on their website, and so the link to their resources will be in the description of this video. And so, anything else you want to touch on before we wrap up?
Yeah, there's so many resources out there. A quick Google search, I mean, you can just see how sometimes overwhelming but great it is that there are so many options. So, like I said, if that seems overwhelming, come into any of those town spaces, and we can help you out, point you in the right direction.
Well, Becca Lewis, Substance Use Prevention Coordinator for the town of Stoneham. We appreciate taking the time today.
Yeah, thanks for having me. Happy to advocate for mental health, and May is a great time to do it.
Awesome.